Hi, I'm Nikki Knowles.
Hi, I'm Becky Himes.
And I'm Keisha Baker. We're the midwives of Dallas Birth. We're here today to answer a few frequently asked questions about out-of-hospital birth. So the structure of midwifery care is really similar to the structure that you might be used to with traditional OB care in terms of how frequent your appointments are. So we usually do your first appointment between 9 weeks and 12 weeks. It just depends on if you want to do genetic screening or if you want to do an early confirmation sonogram. And then from there we see you monthly until 28 weeks. From 28 weeks to 36 weeks, we're going to see you every other week. And then from 36 weeks until you deliver, it will be weekly. But the biggest part that's different with us is how long our appointments last and also how they're structured. That's a very big difference with midwifery care. So
Yeah, usually, your first appointment could be anywhere from, I always set aside like 2 hours, you just never know. But they're usually around, that after the initial appointment, it's like an hour. We set aside an hour. I always tell people, it doesn't take me an hour to do vitals on you and baby. Like, I'm really wanting to get to know you, get that personal aspect of care. And, I'm not just interested in your uterus. Like, I want to know the whole person.
Yeah, we want to get to know you, and we also want to get to know your baby. And that's what helps us keep you safe. That's the difference with midwifery care, is we know you as an individual, and so we know when something's off with you.
Right.
And that's how we keep you safe. And also during appointments is an opportunity just for us to counsel you on nutrition, what's going on with you emotionally, prepare you for your out-of-hospital birth, and all of those things are really key to midwifery care. Also, another aspect that's really nice is we have an in-house sonographer that comes in to do your ultrasounds for us. And then we also do labs in-house for you as well. So we don't have to send you somewhere. We do your labs right here at your appointment.
Right. So there's a lot of individual care, and we do give you the option of different things that you can opt out of or that you can choose to do as well. And we go into length at each appointment about what to expect at the next appointment. We also give you a lot of tips of the trade, things like different exercises that you can incorporate into your daily living, and give you suggestions on chiropractors and holistic care. And again, like the girls were saying, just getting to know you individually, and seeing what works well for you versus just having you come in, checking your vitals, listening to baby, and seeing you 4 weeks later.
We really focus on shared decision making. I think that's like the biggest part of our care too.
That's key in what we do, really, actually.
Right. And we do allow the older children to be as involved as they want to be. The children love to listen to the baby with the Doppler and even measure mom's belly. So again, they see midwifery care as normal, and what mom is going through is normal, and just again involving them as much as they want to be. And some children don't want to be involved at all. So they're like, no, I want to play with the toys.
But it is really sweet. I think it builds in the anticipation for that sibling, and it really helps bring a new sibling into their home. I actually do see that, because they felt like they were a part of the care. They maybe had a little responsibility in the care, and so now they're excited to bring this baby into their family. I think that's one of my favorite parts about our care is once there's a sibling involved and they just get to hop up on the table and be a part of it. They can snuggle up next to mom during an ultrasound, and that's one of my favorite parts.
So I love it. We have been together for 8 years. We started working as doulas initially, and worked together in a practice. And so we know each other very well, and love working with one another. How our practice works, that's a question we get a lot, is our clients my clients are my clients, their clients are their clients. We do not rotate call. We do not, have a certain set of days per month that we are on call for one another.
Well, I think, we back each other up, in the event that something emergent were to come up with one of us who we had to send a backup, you know that you're getting somebody with the same experience, with the same model of care, with the same outlook to midwifery care and birth. And so you have that reassurance that you're not having somebody come in that's completely different than the midwife that you got. Now that's really rare, but that's what's responsible, is to have a backup. And then we also use each other to assist each other, which is really nice. Something that's really important with midwifery care is being able to communicate without speaking, especially in an emergent situation. And so the benefit of us working together for the last 8 years is that we can do that. And that's really great. Saves time and energy when you're needing to work quickly or move quickly. I trust my clients with these guys, which is really hard, over the years as a doula before we were partners. If you needed to call in a backup, you're like, oh, who's gonna be like me? Who's gonna do just as good of a job? And there is so much peace of mind knowing that if I had to call in one of you guys, you're gonna take care of my client the same way.
That's one of the things that people ask me, like, in the event that you can't make it for whatever reason, whatever that may be, I tell them, I'm like, listen, I trust the people that I work with. Like, I don't even give a second thought, to one of these ladies coming. Like, I'm like, well, of course they're going to get great care. We work together. Like, of course, So, and I think the other thing too, about our practice is we do take low volume client load. That's just our preference, to take low volume. So we, have just a few people a month. And part of that, is to ensure that we make it to your birth, right? So you increase your chances of, making it to your client's birth if you have a lower, client volume.
Well, and lower volume also allows for us to know our clients really well.
Exactly.
And if that client is needing more attention, specifically at the birth, when I was a doula, I would see clients transported to the hospital just simply because the mama was tired, but also the midwife was tired, and we can't help it if we have a couple go back to back, but if that doesn't happen very often, we're rested enough to be with you and stay with you the long haul, and to only change the plan if need be, or if you make that decision, and so keeping a lower clientele load helps us accomplish that for our clients.
And people often ask us, are there certain days that we take off per week, or is there a certain month that we take off? And really, we're on call 24/7. Usually what we do is take a month off or 6 weeks off at some point during the year. That way we know that there's not a chance of a mom going into labor at 37 weeks or 42 weeks. So when we take you on as a client, the fact of the matter is, if we do take you on, we're not planning to go anywhere.
Exactly.
When your due date is, if that makes sense.
And then the benefit of that too is that we're able to stay rested, right? Because we take a good chunk of time off, and then that's where we can fill in for each other. Say I go, out of the country for a week, and Becky can take off for me and answer questions. If we do take a chunk of time off, then we can do some clinic days for each other, and you would see the partners for that. And it's kind of cool too, because then you get to know them, since one of them will probably be at your birth. So
we do have 2 childbirth educators as well, and we also have doulas in our practice as well, and we all collaborate, and we also have other resources and other individuals that we refer out to. So we have a large community of people that we love and that we refer our clients to all the time. So if people ask, well, hey, do you have somebody that you recommend for breastfeeding or postpartum care, we have a lot of people, either if they're not in our practice with Dallas Birth, there's other people that we love and trust that we can refer to as well.
Absolutely.
Another common question that we get is who's at the birth. So obviously your midwife is at the birth, and we actually also have another licensed midwife that attends the birth as well. That person is an assist. So, most people assume it's just your midwife. No, your midwife needs an assistant as well. So we do have another licensed midwife that comes in to assist at the birth. Now, the next question is, who is allowed at the birth? Well, anyone's allowed, but we kind of like go into detail of who should be at the birth. What we're really big on is the people that attend your birth should be the people that support your plan. So whether that, if you want your mother to come, that's great, as long as she supports you. If your mother is freaked out by the idea of you having an out-of-hospital birth, she probably shouldn't be there. Sometimes people hire a birth photographer. I'm a fan of it. I love a good birth photographer.
We do.
So a birth photographer, but obviously, your partner, your spouse. Some people have their children there, which I think is amazing. Again, it goes back to, children being at the prenatal appointments, and we really try to normalize birth for the whole family. So it's really nice to, see like your older babies there, at the birth. It's just about like who's going to support, what your plan is, because you want to feel protected, loved, and safe in that environment. And so someone that doesn't support that could really throw things off. You guys agree?
Yeah, absolutely. Yeah. And hire a doula.
Doula.
Former doulas.
Yes. Former doulas.
Hire a doula.
For the love of
And
God.
people often ask, what is the difference between a doula and a midwife? We get the statement all the time of, wait, that's not the same thing? You guys aren't doulas and midwives? Or do doulas deliver babies? Or how does that work? There's definitely a difference.
A huge difference.
And so that doula is there for, emotional support and will help you in that early phase of labor when you're specifically your partner or spouse is flipping out a little bit because they don't know what's normal and what to expect necessarily, and everything that they've learned in the childbirth education classes just goes out the window. So they're there to encourage and support and give you different tips on what you can do to help labor progress and keep you comfortable. Because if, specifically for first-time moms, if they're going to have a really long labor, it's important that the midwife is, of course, still communicating with the client, but the midwife is resting, and then that way they can be fully rested when it's very vital, for them to be there.
Yeah, because our job is to take care of you medically. And so while we do offer a lot of hands-on support throughout the labor and we're very present, we have to stop and go chart what we just did, and we have to make sure that we're taking into account all the things that are going on in the room to keep you safe. And so it's hard for us to give full attention on you breathing with every contraction or doing a hip press with every contraction. And so we're able to work together as a team with a doula if you hire a doula, which is really beneficial to you. Another question along with the who can be at the birth are pets. Do you guys
Yes,
get that
we get
question
that all the
a lot?
time.
We love a little doggy doula. So
so cute.
Yeah,
One of my clients asked if she could have her bearded dragon at the birth.
Sure. Can we take a photo of that?
As long as we can post about it.
What's a bearded dragon?
A lizard.
It's like a giant lizard.
Giant lizard.
I didn't know.
So yes, you can have your pets at home.
You can have your pets at the home. Yeah, at the birth center we can't because it's a medical facility, but at home you can have your pets with you. So, We offer two different options for out-of-hospital birth. We offer the beautiful birth center, which we're sitting in right now, and then we also offer home birth. So it really is what meets your needs, what you feel most comfortable with. I love both, and there's benefits to both, really. The biggest difference between birth center birth and home birth is really just proximity to the hospital.
Right.
most of our clients do live in a pretty, close proximity to some major hospital, but we are 3 minutes door to door from our facility here to Baylor, which brings some comfort to parents, But on the other hand, Nikki learned something from her preceptor, and what was that? That you told me recently. You said the first intervention.
So my wonderful preceptor told me that the very first intervention in labor is leaving your home.
Yeah, which I thought was really good.
So if you think about it, it's like we talk about all of these interventions in birth. And so the very first one is leaving the space where you're most comfortable in, right? And so now you have to adapt to a new environment, get to that place, and then, okay, now we need to get back in the groove again.
Yeah. So if you are at the birth center, we always recommend laboring at home for a good while until you come here. And then we're just like a home away from home that's close to the hospital. But we bring all the same emergency equipment and medical equipment to your home. So the safety, there's no difference between that aspect and what we're doing at the birth. It's just the proximity to the hospital that makes a difference for people.
Yeah, and I think another good point to that too is why people will probably choose birth center over home. Some people, they may live with their parents. I have a couple that just recently moved here, and they live with their parents, and she says there's no way on God's green earth I'm going to deliver my baby with my mom in the room next door. Right. So I'm choosing a home birth, or someone that lives very, very, very far from a hospital, and it's just not probably the best decision, to have a baby that far out, will, choose to have, a baby at the birth center. So.
And we also get the question, or people will say, well, I live in an apartment, so I don't have enough space, or, it's not pretty enough. Let me tell you, we have attended so many births and have seen different living spaces, and midwives are like ninjas. Yeah. We can move around and do what we need to do. Yeah. And one of the things that we do beforehand is we do a home visit, and that way we can go check out your home, give you suggestions on what you can do to help us whenever we do arrive for the birth, like cleaning off a certain space on your dresser. That way we have a place for our equipment, and just going over some of those things. That way when we get there, we're ready to go. Also, giving us the home visit is important too, because we also learn, okay, is there a code to a date?
Or three.
Because usually we get called in the middle of the night, and
it's dark, you can't see.
See, and you don't want to be driving around going, is that it? So just being able to visualize the home, the exterior of the home too, is very helpful.
I know where you're going.
That's true.
On the topic of home birth, the common question is, what do we bring to a birth? And regardless if it's at home or out of hospital, what medications do we carry? So we carry the same medications to your home that we have at the birth center, but we do carry medication. That's a common misconception. I've been asked by medical providers that I have relationships with that are like, I'm so glad you became a midwife, but what do you do if she bleeds? And I'm like, I use medication like you do.
All the time.
Now, it is fair that not every state is that legal, but here in the state of Texas, we have really great midwifery laws. Not only do they protect us, but they protect you as a client. That's why Texas is one of the best places to have an out-of-hospital birth and to practice midwifery and to hire midwifery care. So we bring oxygen, we bring equipment to resuscitate the baby, to create an alternate airway for the baby should we need to, we bring that medication for the mom, we carry antibiotics, we can start IVs. So we do have access to all of those things that we bring with us to the birth, and we're trained in them. And not only were we trained in them, we continue to train in them and to practice and do simulations, because luckily our clientele load is very low risk, right?
Yes.
And so And so we don't have to do that. We're really there for your insurance and assurance at the birth, but what we're trained to do is handle the emergency.
Right.
And so we practice those emergencies all the time so that when an emergency arises, we have practice and we jump in and we're able to handle it quickly.
Now, we don't offer pain medication.
That is
a
yes,
question that we
question,
get
yeah.
often.
Yeah.
You know, we actually get asked if we do epidurals at the birth center or at home. We do not. We also, again, we don't offer any type of narcotic. We're not allowed to do that. We also are unable to induce. So
Medically
induced.
yeah.
We're not allowed to do that as well.
We have natural induction options, and but we're not able to start your labor with Pitocin or something like that, which really you don't want to do unless you're in the safety of a hospital as well. So. All right, so number one question I get from dads is, if we're at home, what about the mess? I can't handle the mess. What do we do about the mess? It's so funny. That is just like it was my husband's question.
Yeah.
It was truly, and his mom had all her babies at home. And he was like, but I don't want to deal with the mess.
Yeah. So most people think that it's going to look like a murder scene. I don't know why.
Hollywood.
Yeah. If your home looks like that after the birth, there's so many things that went wrong.
Yeah.
So many things like that. It never happens, right? So we clean up as we go. You know, and I'm sure these ladies do this as well. Like, the amount of Chuck's pads that I go through at a birth are like crazy. I'm like, we must protect the space.
Yeah,
you know, yeah. So you know, we clean as we go. It's not as messy as people think, and honestly, the biggest mess that comes is after the baby is born, you know, and you're usually more in a controlled type of environment. So, you know, mom may be in the tub, or, you know, if you're on the bed, then, you know, you have everything like laid out and protected, you know. So it's not as messy as people think it is. I guess if there's like no frame of reference, or like you said, Hollywood, then yeah, you would think it's crazy, but it's not.
No, I mean, I feel like I leave most births with one bag of full trash for them to put out, and then we usually start a load of laundry, which often that's it. There's one load of laundry. You know, we treat it for you, so that's usually all the mess there is. If we do get anything on something, we're masters at getting it out. You will probably never even know that it happened. And then, you know, back to referencing your ninja about midwives being ninjas, we're ninjas when it comes to getting Chucks under a mom for delivery, you know, because she might think, I was gonna have my baby on the side of the bed, and then all of a sudden she takes off to the living room and squats and has a baby, and we're so good at like,
right,
you know, and getting it in there real quick. So the mess just is not an issue.
Well, and I think we do that, one, just because, you know, we do it, and, you know, we should be doing it, but the other thing too is because we have in our mind that people think
they're so worried about the mess.
Big mess, and there is blood in birth. I mean, bleeding is normal. It is a part of it, and fluids and all of that. But like Keisha said, when we leave, it's usually just a trash bag full of.
Sometimes your house may be cleaner than when we got there. You know. So
well, and we teach you how to make your bed properly, so it's protected, and you know, we have you get certain things to set up your home, and so then we bring our own equipment for you as well, and that also helps as well. Like we're not just walking in and catching a baby. Sometimes we walk in and catch a baby. We're still really good with the mess. It's amazing. I don't know.
Yes, we do clean up after ourselves.
One time I had a surprise. She was supposed to be at the birth center, and then it just was going fast, and so we delivered at home. And I had 2 Chuck's pads on a brand new white rug. We don't know what we did it. No, we did it. It was amazing. So
no stress, though.
So this time she was like, well, I'm just going to be at home.
So partners, no, you do not have to clean up.
We will do it for you.
We will do it for you.
We will do it for you.
Yeah.
A question we get a lot is what happens if we need to transport? And that is a reality of what we do. You know, birth is very unpredictable. There is no black and white, but that is why we spend hours and hours and hours training on how to handle a transport situation. We also collaborate with a lot of physicians in the area, and one of the benefits of us being in the birth community for so long is we have developed relationships with physicians over the years who trust us. So with that being said, we do have protocols that we run with Baylor Dallas because of the close proximity of the birth center in Baylor Dallas, and we do those periodically, and then that way we know, and they do as well, how to make the transport as smooth as possible. The number one reason for transport is for exhaustion, maternal exhaustion.
That's more often the reason we're going.
Yeah.
Right. And because we do have those protocols set in place beforehand, and those are things that we talk with the clients in prenatal visits as well. Hey, this is kind of what to expect, and this is what we do. We make it as smooth as possible. So if a transport is needed, again, if a mom is exhausted, or if our care needs to go to the next, the next level, then we do it as smooth as possible. So we can call the hospital beforehand and just let them know, hi, this is, Becky with Dallas Birth, and we're going to be bringing in a patient.
Yeah, and just to add to that, we're discussing all of this with you, so if we know what normal birth looks like. Once things start to go outside of normal, that's when we have a conversation with you.
Right.
It's like, okay, this is what I'm seeing. This is, where it looks like it's possibly going. Let's talk about your options. Let's talk about, transporting to the hospital. How do you feel about that? Let's dig into it. It's never really, unless it's an emergency situation where those are rare, but it's never really like, okay, I've made this decision for you to go to the hospital, without talking to you, right? Again, that goes back to shared decision making.
Right.
So, but again, it's very rare. Those, we gotta go now type of situation,
really
transports, they're very rare. So, but again, we have a really good relationship with Baylor Dallas, and we've done emergency drills with them, which was great, so, that helped us to formulate a really good protocol for transports when we need to.
Yeah. And it happens, whether the birth plan changes or you change the plan, it happens. And so that's why we do talk to you a lot about it in prenatals, especially as we get closer. I usually talk quite a bit about it at the first appointment, just so we're all on the same page. And then as we get closer to the birth, we talk about it. If you're at home, we talk about what's your closest hospital. In the event of an emergency, where would we go? And then if it's not an emergency, which again, as these ladies expressed, it's often more just because mom's tired, then we will make the trek out to Baylor, if you're 45 minutes away, just because they're really wonderful at taking care of clients. But it's also up to you. I had a client recently that was just tired, first time mom, and she really had been at it a long time, and she wanted to go. And so I made arrangements to go to the hospital here at Baylor. And on the way, she said, no, I just want to go wherever's closest. And that's what she did. She was very happy, so it's really just all about supporting you and your plan. And even if that plan changes, now everybody does kind of get to a point sometimes, especially first baby, of like, I don't want to do this. This is the worst decision in the world. This hurts, because it is very hard and it is a commitment. And so we're not going to just immediately say, okay, and go to the hospital. We're going to try a lot of things. That is the difference with us in midwifery care. And so we're going to change up your position. We're going to put you in the tub. We're going to do a lot of things to encourage you that this is one of the hardest things you will ever do, and continue to encourage you. Like Nikki said, though, we've been around birth a long time. And so every once in a while we can tell when that time comes where it's like, this is not normal, and so we know there's a difference. But a lot of times mamas just need to change it up. We just need to get in the bath or do something different,
go outside.
and they don't ask again, so there is a difference in saying, this is really hard and I don't like this, and we need to go, we need to change the plan.
Yeah.
the short answer to the question is any of us can take insurance. It's the bigger question is how much will your insurance cover and pay? That really is up to your individual plan and what's best. We have a cash pay price that's a lot less than a typical insurance price. So for a lot of people, they're benefited more by actually going that cash pay route. But we can always check into your insurance and your benefits and talk about options. We have some people that do the cash pay and then they file later and they try to seek the benefits. There's just different ways to go about it. I do encourage anyone who's interviewing me though, if finances are an issue, first of all, talk to us about it so that we can come up with a good plan for you. And then second of all, when you're talking to other midwives, make sure you have a really good picture of what it is you're going to be paying. Because like I said, anyone can take insurance, but it's really about what is your insurance going to pay and cover. And so you want to make sure you're going the best route, whether that be the cash pay or going the insurance way. So we have options and we can talk to you about it and your specific needs. You know, I do think though, bottom line is you're paying for an experience. Right. It is a different experience than out of hospital. And I will say that a good number of my clients just pay out of pocket and that's worth it for them. And so a lot of them don't even go the insurance route. It's not worth it for them to do that. And they're paying for the experience and that's what they want. So
it's more like a concierge service.
Oh yeah. I mean, you have our number. You can let us know. I mean, I will say when I was a doula, you know, of course, because that's the way that an OB practice is set up. But if their baby wasn't moving, they're calling in, they're talking to an answering service, and then they're calling me, you know, which it's not in my scope of practice to tell them what to do, but they're having to wait 15, 20 minutes. With us, you call us, you get us. And if you don't get me, one of their numbers is on my voicemail and you're calling them, you know, so you get direct access to this and that's something you're paying for. And really it's a fraction of the price of what you do pay for OB care. So that's how it's set up.
Yeah.
So many things I love about midwifery care. I think one of my favorite things is the newborn exam. As a doula, I saw so many newborn exams in a hospital setting, and they do a great job. But what's different with us is that the baby is just right there in front of mama and daddy, and if there's any siblings, they come in and they're around it, and they're helping, they're measuring, they're weighing. We're so gentle, you know, and we're including them in the care. We're not just overdoing and throwing the baby back and forth real quick trying to get it done. It really is a part of the whole process, and it's fun to document. I just love how we do it. It's very personal, it's very gentle, and the parents are learning about their baby, the siblings are learning about their new sibling as we do it, and it's a really special part to really end the home birth or the birth center birth, right? Because it's one of the last things that we do. We really try to leave the baby undisturbed for a good while. So it's one of the last things that we do. And they get to end with, you know, maybe dressing the baby or putting baby back skin to skin. And it's just really sweet.
One of my favorite parts, I would say, is after the mama has worked so hard and finally has her baby in her arms, to see the reaction of their partner. They're like, oh my gosh, you're so amazing. Thank you so much for doing this, you know, and just, they're so impressed with, and thankful. They're like, thank you so much for doing this for us. And there's just, you can see almost where their viewpoint, I mean, not necessarily changes, but they definitely, the mama definitely gains street cred, you know. They're like, man, that is so amazing. Look what you've done for our family. And they're just in awe over, you know, over it. So, I mean, it's just, it gives me chills every time. And just to look over there at the partner and go, man, that's so cool. And you can just see them gleaming, you know.
I always say, you win forever.
Like
that's now they always win.
They always win. They always win. Yeah, for sure.
For me, my favorite part, my most favorite thing is when a mom comes in for her very first appointment with me and we get to listen to her baby. You can ask anyone, like I tear up a little bit, like with my clients, just hearing that baby's heartbeat, especially for a mom that's been trying for years to get pregnant or had, you know, unfortunate losses and, you know, just hearing that sound, sometimes you just see the relief just wash over them. And then it's like, you know, it's almost like getting to experience, like being in that moment with them and it's like a privilege to experience that moment with them. And then you go, you know, you're going through this whole pregnancy with them, and you're taking care of this baby, and you're taking care of this mother. And then to see that mother work so hard, be in her presence, be in this, you know, I always say that women are their most strongest when they're laboring. And so to be in the presence of that, and then to see her birth that baby, and to think about the first moment you heard that baby's heartbeat is overwhelming. That's my favorite part.
Comes full circle.
Yeah, full circle.
It does.
Yeah.
I love it too whenever we walk into the home, or you know, they're coming to the birth center and just being allowed to be in that space.
Yes.
I mean, it's such a privilege,
It
such
is
an
a
honor. It
privilege.
is very much an honor to be allowed to be a part of such an intimate thing. And and families trust us so much, you know. And
I
it's
always
just
say
so
thank
lovely.
you.
Thank you.
Thank you.
I know they thank us, and it's like, no, thank
No,
you.
thank you.
I mean, you just, every time a baby's born, we watch the world change forever.
Yeah,
and that's
that's
something
true.
that I think about
That's
a lot.
true.
Like, that human just came earthside, and the world just changed,
Yeah.
because
You
you
never
never
know
know
what
what they're going to be, who they're going to be, what they're going to do, whose lives they're going to impact. And you experienced that, and so we're so lucky. That's probably why we try to be professional, but we cry and tear up, and our clients are so special to us, you know, because we've spent all this time getting to know you, and then to see everything
like you did.
Yeah.
So
Yeah.
Yeah.
Yeah.